Hello and welcome to Your Planned Cesarean Birth at Waitemata DHB. Let's talk about what to expect when you have your cesarean section. About 1 week before your operation, you will be given a date and a time that you need to arrive at the hospital. Please let staff know if you have any transport issues or concerns that you may not arrive on time. The day before your cesarean, you need to go for a blood test at your local lab test clinic. Different clinics have different opening hours. Some are not open on the weekends or public holidays. You can phone to find out about your local clinic. It is important that you stop eating 6 hours before your cesarean, although you can still drink water up to 2 hours before. This is to protect your lungs from any inhaled food or drink if we need to get you off to sleep with a general anaesthetic. Once you are at the hospital, there will be lots of people for you to meet before your cesarean, including a midwife, an anaesthetist, an obstetrician, and a theatre nurse. A midwife will welcome you, help you to get changed and ready for theatre, listen to your baby's heartbeat, and help you put on some compression stockings. Your midwife will also check to see if you have any special requests for the birth of your baby, such as music, delayed cord clamping, a karakia, or prayer. An anaesthetist will talk to you about what will happen during the operation, talk to you about the medicines they will use and how these will make you feel, and talk to you about the possible risks and ask you to sign a consent form. Women generally choose to have an injection in their back that numbs the lower half of their body. For some women, however, having a general anaesthetic and being asleep is better. Your anaesthetist will discuss this with you. An obstetrician will discuss why a caesarean is being recommended. They will also discuss details like the kinds of stitches you may have and talk to you about possible risks and ask you to sign a consent form. You could also finalise a plan to have your tubes tied if your family is complete. This is also a time when you may want to discuss any special requests. If you are staying awake for your operation, you can bring one support person into theatre. This might be your partner, a friend, or someone from your whānau. During the operation, they can sit beside you and be there when your baby is born. When you get into theatre, it might seem like there are lots of people. Everyone has a specific job to do looking after you and your baby. There will be some more safety checks. Your anaesthetist will confirm your details again and you'll meet the anaesthetic technician who helps your anaesthetist. You will have an IV line placed in your arm or hand. The technician will put an oxygen monitor on your finger and blood pressure cuff around your arm or leg. You'll be asked to sit on the edge of your bed with your feet flat on a footrest. Your anaesthetist will then get ready to start your anaesthetic. If you're having a regional anaesthetic, then you'll have to drop your shoulders, put your chin to your chest, and curl up into a ball, opening up the spaces in your lower back. Alternatively, we might have you lying on your side. The staff in theatre will help you get into a safe position for your anaesthesia. Once you're in position, your anaesthetist will wash your back with a cold liquid. They will then put a small injection of numbing medication into your back. Once your back is numb, they will then put your anaesthetic in, and you will feel touching and pushing during this part of the procedure, but it should not be sore. As soon as your anaesthesia is in, you might start to feel a bit warm and tingly in your legs and bottom. This is a good sign that your anaesthesia is already starting to work. The theatre staff will help to lie you down on the operating bed, and the bed will be placed on a bit of an angle to help keep you and your baby comfortable, but don't worry, you won't fall off. You'll then have a catheter placed in your bladder. You may still feel touching at this point, but this shouldn't be uncomfortable. Your anaesthetist will then check that your anaesthetic is working. We know that if you can't feel temperature, then you won't be able to feel pain, so we start by using cold, but we check with a pinch test too. We won't start the caesarean until we are sure that you are comfortable. Once we are happy that your anaesthetic is working properly, the obstetrician will perform another safety check with the rest of the team in theatre, and your caesarean can begin. The staff in theatre will put a drape up between your chest and your stomach so that your support person doesn't have to see the actual caesarean. You will be able to feel some strong pulling sensations, pressure and movement, especially while your baby is actually being born. But you should not feel any pain, and your anaesthetist will be there to support you the whole time. The team will talk with you throughout your cesarean, and there will always be someone next to you to ask questions. After your baby is born, it usually takes less than 45 minutes for the doctors to finish the operation. If your baby is well, we aim to have them with you as soon as we can. We encourage skin to skin as soon as you feel ready. After your cesarean, you'll be moved to the recovery area, where a recovery nurse will make sure you are comfortable and check on you frequently. A midwife will help you with your first breastfeed and make sure your baby is adjusting to life. When we are happy that you can leave the recovery area, you will be moved to the maternity ward. Most often, you will be sharing a room with one other new mum. A midwife will weigh and measure your baby and check them all over and give them vitamin K if you want this. You will be able to have regular pain relief and anti-sickness medication on the ward. Please let your midwife or nurse know if you need more. The day after your cesarean, an anaesthetist will visit you on the ward on the pain round to make sure that you are comfortable. To help you recover after your cesarean, it is a good idea to have something to eat and drink as soon as you feel like it, move out of bed for a short time 6 hours after your cesarean, have your catheter removed once you are on your feet so that you can move more freely, and take your pain relief tablets regularly. The midwives and nurses will help you to find comfortable positions for breastfeeding, and these early days after your cesarean are a great time for you to spend time skin to skin with your baby. Women generally stay in hospital 3 to 4 days after a cesarean, but some go home sooner. It will take at least 6 weeks to recover, and you will feel sore around your scar and tummy. The physiotherapist can give you some advice on how to move safely and comfortably. If you have any questions about your cesarean, please talk to your midwife or any of the hospital staff looking after you. Thank you. We look forward to meeting you and your family.